Hello and welcome back to everyone, and a special welcome to all our new subscribers. I hope you all had a nice weekend.
Yeah, it's good to be back.
We've been doing these deep dives every week, and sometimes it's nice to have a break.
It definitely helps recharge.
And today, we're back with a new topic, sunlight.
Ah, a bright one.
Exactly. And if you're enjoying deep dives like this, focused on your well-being, you'll be happy to know that we're part of the Detox Health channel, and we have many more health-focused discussions planned for you.
Lots more good stuff coming.
Today, we're shining a light, pun intended, on the benefits of sunlight, drawing from a really interesting collection of articles.
Uh-huh.
Our goal today is to really dig into how sunlight affects our health and perhaps clear up some of the, common worries around sun exposure
Right.
by looking at what the evidence actually tells us.
I think's good.
You, our listener, have probably heard both the good and the bad about the sun. So let's explore that together and see what the science truly reveals.
Okay, let's dive right into this idea of a solophobia, as one of our sources put it.
Solophobia.
Dr. Robert S. Stern talks about how many people have become so concerned about skin cancer
Mm-hmm.
that they're consistently avoiding sun exposure, really covering up whenever they go outside.
You see it all the time. Hats, long sleeves, even on milder days.
Exactly. And what's fascinating here is how the promotion of high SPF sunscreens and all this protective clothing might have unintentionally amplified these fears.
Yeah, the marketing is everywhere. But I mean, it's almost impossible to miss the warnings about sun damage either.
True.
And of course, those warnings are rooted in reality. We know that both UVA and UVB wavelengths impact our skin.
Right. The two main types of UV we're concerned about.
The longer UVA waves are a major contributor to photoaging. Think of wrinkles and that dry, leathery texture.
Yeah, the stuff that makes skin look older over time.
Then there's UVB, the shorter wave, which is what causes sunburn, and can actually damage our DNA and even suppress the skin's immune response.
Right, which is a big deal, that immune suppression part.
Definitely.
And if we zoom in on the science a bit, UVA's ability to generate what are called reactive oxygen molecules.
Okay.
It's quite significant. Think of them like tiny damaging particles that can harm cell membranes and directly damage our DNA over time.
So basically, they cause damage at a cellular level.
Exactly. So being cautious about sun exposure is definitely understandable. There are real risks.
But it sounds like the relationship between the sun and skin cancer isn't quite as straightforward as simply, more sun equals more risk.
That's right.
Our sources suggest there are other important pieces to this puzzle, right?
Absolutely. Our genetic makeup plays a significant role. Some individuals are just genetically more or less prone to sun-related skin damage.
Okay, so your genes matter.
They do. And then there's skin type. People
Yeah.
with very pale skin who burn easily and don't tan well are naturally at a higher risk.
That makes sense.
What's also really interesting is the concept of the dose of sun exposure.
How much sun you get.
Yes, but perhaps even more importantly, the pattern of that exposure.
Pattern. That's not something I really considered. I always assumed it was just about the total amount of sun exposure over time.
Well, several studies indicate that sudden, intense periods of sun exposure.
Like going on vacation somewhere sunny.
Exactly. Think about someone who is indoors all winter and then gets a severe sunburn on their first day of a tropical vacation. That might actually be more risky than more consistent, moderate exposure over time.
Ah, okay. It's like shocking the system, maybe?
Sort of, yeah. It's as if the skin isn't given the chance to adapt gradually.
That makes intuitive sense. And what about the age at which sun exposure occurs? I recall reading that was significant.
Yes, that's a crucial point. A Scandinavian study found that sun exposure during childhood and adolescence, specifically before the age of 20,
The 420, wow.
appears to be the most critical period for melanoma risk. So those sunburns you might have gotten as kids could have long-term implications.
That's definitely something for parents to be aware of. Now, our sources also distinguish between different types of skin cancer and how they relate to sun exposure, don't they?
They do. It's not all the same.
Right.
For instance, recent sun exposure doesn't seem to be strongly linked to basal cell carcinoma, which is generally considered the least aggressive form.
Okay, the mildest type.
But squamous cell carcinoma is different. Both the total amount of sun we've accumulated over our lifetime and recent intense exposure are strongly associated with actinic keratosis.
Those rough, scaly patches.
Exactly. And those can sometimes develop into squamous cell carcinoma. So it's not a uniform risk across all skin cancers. The type of exposure matters for the type of cancer.
Okay, so we've established that there are legitimate risks associated with sun exposure,
Yeah.
especially intense or early life exposure. Definitely need to be careful.
Absolutely.
But our sources also present a compelling argument for the really vital benefits of sunlight, and vitamin D is usually the first thing that comes to mind.
Exactly. That's the big one everyone knows about or thinks they know about.
Right.
What's fascinating is that the very UVB wavelengths that sunscreens are designed to filter out,
The ones that cause sunburn.
yes, those are also the key to our skin's ability to produce vitamin D.
Ah, so there's the trade-off right there.
Precisely. And as all our sources highlight, low vitamin D levels are incredibly common, like surprisingly common in many populations.
And we know vitamin D is absolutely crucial for maintaining strong bones, that well-established link to conditions like rickets, osteoporosis, osteomalacia. That's undeniable.
Totally established science. Bone health is key.
But the benefits of vitamin D, and perhaps sunlight itself, seem to extend even further, don't they, based on what we read?
They do. Research has explored potential connections between low vitamin D and a whole range of other conditions.
Like what?
Things like multiple sclerosis, even prostate cancer.
Wow, really?
Now, it's really important to understand that a link doesn't automatically mean cause, right? Correlation isn't causation.
Right, important distinction.
But it certainly suggests a possible relationship that warrants further investigation. And when we think about the broader implications for public health,
Yeah.
ensuring adequate vitamin D levels through sensible sun exposure, or maybe supplementation for some, seems increasingly important.
Okay, so beyond bones, possible links to other serious conditions. And it's not just about our physical health, is it? Sunlight appears to have a really significant impact on our mental and emotional well-being, too.
That's right. This is another huge area. Exposure to sunlight is believed to increase the levels of serotonin in our brains.
Serotonin, the feel-good chemical.
Pretty much, yeah.
Right.
It's a neurotransmitter that plays a vital role in regulating our mood, promoting feelings of calm and focus.
Okay.
On the flip side, darkness triggers the release of melatonin, which is the hormone that helps us prepare for sleep.
So it's like a natural light-dark cycle that helps regulate both our internal clock
Our circadian rhythm.
and our emotional state. And if we don't get enough sunlight, what happens to our serotonin levels?
Well, the thinking is that insufficient sun exposure can lead to a drop in serotonin levels.
Uh-huh.
And low serotonin has been linked to an increased risk of seasonal affective disorder, or SAD.
SAD, right, that winter depression some people get.
Exactly. It's a type of depression that tends to occur during the fall and winter months when there's less natural light available.
And that's why light therapy is such a commonly recommended treatment for SAD, isn't it? Those special lamps.
Precisely. Light therapy boxes mimic the intensity of natural sunlight, and when that light enters the eyes,
Through the eyes, okay.
yes, it stimulates the brain to produce serotonin and helps to reduce excess melatonin. It's a direct way to address the neurochemical imbalance thought to be caused by a lack of sunlight.
It's really quite remarkable how something as fundamental as light can have such a profound effect on our bodies and minds.
Isn't it? And it sounds like the benefits for mental well-being extend beyond just SAD.
Oh, yeah.
Yes, some sources mention that sunlight exposure may also be beneficial for individuals experiencing other forms of major depression, premenstrual dysphoric disorder, PMDD, and even for pregnant individuals struggling with depression.
Interesting.
There's also a suggested link between anxiety-related disorders and reduced exposure to sunlight. The key mechanism seems to be that light entering the eyes, triggering that serotonin release.
So even on a cloudy day, just getting outside could still offer some mood-boosting benefits? Because some light still gets through, right?
Absolutely. Even diffused sunlight can have a positive effect. It doesn't have to be bright sunshine.
Good to know. But the benefits of sunlight go beyond just vitamin D and mood regulation. There are other fascinating physiological responses that occur.
Yeah, this part was really interesting.
Such as, I'm really intrigued.
Well, one source discussed how UVB exposure stimulates the skin to produce beta endorphins.
Endorphins, like the runner's high kind of thing.
Exactly. We typically associate endorphins with activities like exercise, but sunlight can actually trigger their release as well.
From the sun. Wow.
Yeah. And these beta endorphins have a wide range of beneficial effects. They can reduce pain, promote a sense of well-being, strengthen the immune system, aid in relaxation, help with wound healing, and even increase alertness and job satisfaction, which is a really interesting connection.
Job satisfaction. From sun.
Apparently so, according to that research. maybe liea, the general sense of well-being it promotes.
That's amazing. It makes you wonder if that feeling of just enjoying a warm, sunny day is more than just, a pleasant psychological experience. It's chemical.
It very likely is. And there's more to consider. Research suggests a link between sun exposure and lower blood pressure.
Lower blood pressure. How?
The current theory is that sunlight triggers the skin to release stored nitrogen oxides,
Okay.
which cause our blood vessels to dilate or widen, leading to a reduction in blood pressure.
Huh. So sunlight could actually be good for our hearts in that way. That's a surprising benefit that I haven't heard much about before.
It's an active area of research, but the initial findings are certainly promising. This could have significant implications for reducing rates of cardiovascular disease and maybe the impact of metabolic syndrome.
Wow. Okay, what else?
Furthermore, multiple sources mention research suggesting that increased sun exposure might offer some protection against several diseases.
Protection. Against what?
Things like type 1 diabetes, multiple sclerosis, we mentioned the vitamin D link there already,
Right.
and certain types of cancer like colon, breast, prostate, and non-Hodgkin lymphoma.
Okay. Again, need to be careful about correlation versus causation.
Absolutely critical point. These are mostly observational links so far.
But these are certainly intriguing connections that warrant further study.
Definitely.
And we also touched on how sunlight plays a role in regulating our sleep-wake cycle.
Yes, through that interplay of serotonin and melatonin, sunlight is absolutely crucial for setting our body's natural circadian rhythms.
Our internal clock.
Exactly.
Yeah.
Which governs so many of our fundamental biological processes, including sleep. And, the World Health Organization even states that sun exposure can be a helpful tool in treating certain skin conditions.
Like psoriasis.
Psoriasis, eczema, even jaundice in newborns sometimes.
It's almost as if sunlight is this powerful, yet often overlooked therapeutic resource.
It kind of seems that way, doesn't it?
Yeah.
And there are even preliminary links to other health conditions, right?
Yeah, what were those?
Potential benefits for conditions like rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease, and thyroiditis.
Autoimmune conditions. Interesting.
Exactly. But again, the sources rightly emphasize that much more rigorous research is needed to confirm these initial findings. It's still early days for some of these connections.
Understood. This paints a much more nuanced picture of sunlight than just, it causes skin cancer, avoid it.
Definitely more complex.
So how do we strike that balance? How do we ensure we're getting these benefits without exposing ourselves to excessive harm? That's a million-dollar question, right?
That's the key question we all need to consider. All our sources reiterate that excessive sun exposure does carry risks, primarily skin cancer, due to the damage UV radiation can inflict on our cellular DNA.
Okay, the risk is real.
Absolutely. What exactly constitutes excessive really depends on individual factors.
Like skin type, which we mentioned.
Right. Skin type, how easily you burn, and also the intensity of the sun's rays, which are typically strongest between the hours of 10 a.m. and 4 p.m.
So those midday hours are when we need to be particularly mindful and perhaps seek shade or cover up.
Exactly. That's generally the advice.
What about specific recommendations for getting enough vitamin D without, frying ourselves?
Well, the World Health Organization recommendations suggest that just 5 to 15 minutes of sunlight exposure on your arms, hands, and face.
Just arms, hands, and face.
Yeah, relatively small area. 2 to 3 times a week might be sufficient for most people to maintain adequate vitamin D levels.
Okay, 5 to 15 minutes, a few times a week. That doesn't sound like much.
No, but it's important to remember that sunscreen or clothing will block a significant amount of this UV radiation
Right.
and therefore hinder vitamin D production during that time. So this recommendation is generally for unprotected skin.
Got it. So a brief period of unprotected sun exposure might be beneficial for vitamin D synthesis, but for longer durations, we should definitely be thinking about protection.
Precisely. For any sun exposure lasting longer than those short, say, 15-minute intervals, using a broad-spectrum sunscreen with an SPF of 15 or higher, and wearing protective clothing, sunglasses, a wide-brimmed hat that's highly advisable.
Standard sun safety advice for longer periods. Okay. Now, it's interesting how some people really struggle with a lack of sunlight, particularly during the shorter, darker days of the year. We talked about SAD. Are there specific factors that might make someone more susceptible to this?
Yes. Some sources note several risk factors. Individuals with a family history of SAD, for example.
Okay. Genetic link again?
Seems possible. Also, a personal history of other mental health conditions like depression or anxiety. And geography matters. Those who live at higher latitudes, further away from the equator, tend to be at a greater risk.
Less sunlight overall there.
Right. It's also worth noting that SAD is more frequently diagnosed in women than in men.
Interesting. And it's so important to remember that SAD is more than just a case of the winter blues. It's a clinically diagnosable condition.
Absolutely. It can significantly interfere with daily functioning, leading to persistent low mood, a loss of interest in normally enjoyable activities, difficulties with concentration, and noticeable changes in sleep patterns and appetite. It's a serious condition that often requires professional attention.
Yeah, definitely not something to just brush off. And for those who have limited access to natural sunlight, whether it's because of where they live or their job keeps them indoors or other factors, what are some effective alternatives?
Fortunately, there are several effective options. Light therapy, as we mentioned.
The lamps?
Yes, it's a well-established and often very successful treatment for SAD. One source mentioned an effectiveness rate of around 85% in diagnosed cases, which is pretty high.
That's impressive. What else?
Antidepressant medications can also be beneficial for some individuals. And interestingly, some research suggests that vitamin D supplementation might help to alleviate SAD symptoms in certain people, though that's maybe less definitive than light therapy,
Okay. Supplements could play a role.
possibly. And finally, cognitive behavioral therapy, CBT, has also been shown to be as effective as light therapy in managing the symptoms of SAD. So therapy is another good option.
Right, tackling the thought patterns and behaviors associated with it. It's really reassuring to know that there are viable options for those who struggle with insufficient sunlight.
It is. And I think as we've explored today, the key takeaway here is that sunlight offers this remarkable array of health benefits that go far beyond just facilitating vitamin D production.
Yeah, much more than just vitamin D.
It plays a crucial role in regulating our mood, has the potential to lower blood pressure, and may even contribute to reducing the risk of certain diseases.
But as with so many aspects of health and well-being, it really boils down to finding that sweet spot, that balance.
Exactly, that's the word, balance.
We need to be informed and make smart choices about our sun exposure, protecting ourselves from excessive UV radiation while still allowing our bodies to benefit from all that sunlight has to offer.
Precisely. So for you, our listener, maybe consider this. Take a moment to think about your daily routine and the environment you live and work in.
Mm-hmm.
How much natural light do you actually get on a regular basis? And based on our discussion today, are there any small, thoughtful adjustments you might consider making?
Like maybe taking a short walk outside during a break.
Yeah, exactly. Or positioning your desk near a window if possible. Small things. It's about maximizing those health benefits or minimizing the potential risks, depending on your situation. It's all about being informed and discovering what works best for your individual needs and circumstances.
That's a really insightful point to consider. A little self-audit of our light exposure.
Yeah,
And if you found this deep dive into the power of sunlight illuminating,
I swear.
be sure to explore the Detox Health channel for many more in-depth discussions on topics designed to support your journey towards better health and overall well-being.
Well, there's more to explore there.
And if you haven't already, please hit that subscribe button so you don't miss out on any of our future deep dives.